So for example, the exercises, there's several I would teach. And it's amazing how many people don't know this, but simple exercises like if I'm teaching somebody seated, I'll ask them to engage their pelvic floor. I'll ask them to engage their tummy muscles. Little bit of a glute clench, so bottom muscles are engaged, and then expand their lungs and then bring them back down again. And I'll keep go over and over and over again until they've got it in their head how to do it. And believe it or not, that alone, one of my asthmatic clients said, I feel like I'm breathing better. So for them, for the type of clients I work with, technique and exercise seems to be the way forward. But having said that, there might be the odd one that will do their own research and look for devices like this and give it a go. But they need to be confident in themselves and reassured that they're not going to push it too far.
Can I drag you back now to something that you said? You were talking about the exercise program at the beginning, and you talked about it looking like a circuit training session in the gym. And of course, what I had in mind is that there will be the program will be teaching people how to breathe in properly or breathe out through pursed lips and so on. But it seems to be that there's more to it. What are the exercises in this program? So, as an example,
these are, most people are going to be more familiar with these. It is the squats.
Right.
It is the shoulder presses. It's taking the arms above the head, coming back down again. It could be going up and down a step. It's actually, if you've ever experienced cardiac rehab, it's similar in that sense. The setup can be circuits. If they've got another room where they've got treadmills and cross trainers and things like that, they will go on them as well.
So does that mean you could just say to anyone, well, just go to the gym and do
if they feel confident enough to do so? If they feel confident enough to do so, but they need to have that education of all those sort of markers, the Borg score and the RPE form as well, is if they feel confident enough to do so. But often these kind of places tends to be a bit more on the generic exercise that me and you would be familiar with, but it's that added on what their breathlessness is like. Can they increase the weight? Do they lower it down? Do they make it higher? Do they stick in a chair? Do they do it standing? All those things are taken into consideration.
So would your average personal trainer not be sufficiently adept to progress in this way?
So this is an interesting question. So the way exercise instructors level 1 and 2 are the ones that teaches classes. So no, definite no, they won't know that. Level 3 is personal training, but if they've just done personal training on its own, no. They would need something, at least minimum, something called Exercise Referral course under their belt.
Right.
And that course will go over about 15 main conditions, of which pulmonary conditions are part of them, but they're not in that much depth. But technically, at level 3, they could. But if they come in breathless that day, or they've had to use that inhaler that day, then they need to deem it as an off day. So someone like me who's got the degree or level 4 pulmonary rehabilitation qualification and above, then you can still work with them even if they've used that inhaler, because you've got that more in-depth understanding. So you have to be careful. Level 3 personal training on its own, no. They've got to have the exercise referral course under their belt to work with.
But you can see where I was going with this, because if the 12-week course is free, and they don't value free, but they can pay a personal trainer to do something which is somewhere near as efficient, then there might be greater continuity, greater...
There would be. And this is kind of where I sit, because people who are coming to me are willing to part money, for starters, so there's already that commitment there.
Yeah.
And the problem I have with having worked in the NHS, a lot of what the NHS does is you're in for 6 weeks, you're in for 12 weeks, you're in for that period of time. And interestingly about pulmonary rehab, once you've done the 12 weeks, you can't actually access it again for another year. So, so unless Milton Keynes is one of those rare places where there's a follow-up.
Which is where you work.
Whereas where I work. But they are overrun because there is that many people that need that continuation. Whereas me, I find the 12 weeks or 6 weeks in some teams across where I've worked in the NHS, I find it's not enough. I find it's not enough. And even if we get them to a certain level, the chances of them to continue it is very, very low. So this is where I it's an open 4-week rolling contract, essentially what they have with me. and they can keep coming.
And there are others working the same way you do, I take it.
I don't know.
At the start of the show, I got the impression the only way you could get any pulmonary rehab really was to search for the NHS 12-week courses.
Yes, I believe I'm one of the few that have A, got the experience, and B, confident enough to do it on my own.
Right.
I haven't come across many people like me that are willing to do. There may be, I'm not saying there isn't, but there's not many that will go against the grain and do it their own way.
Yeah.
And put it this way, the pulmonary rehab up-to-date course I did, refresher course I did last year, I was the only one in there independent, doing my own thing. The rest of them were all part of some form of pulmonary rehab at some stage. Right. Whereas I was the only independent one in there. Okay. So I do like doing it my own way.
And you're kept busy, I imagine.
Yes.